Good evening and welcome to the next Buncombe County Let's Talk COVID School Learning and Back to School. Today we're going to hear from a wonderful line of panelists representing Buncombe County and Asheville City School leadership. Our panelists will be here to share information on student health, back to school, and what we can really expect around virtual learning in the 2020 to 2021 school year. And with that, I'd like to welcome all of our panelists to do self-introductions before we kick off our discussions. Shaunda?
Hi, my name is Shaunda Sanford and I am the board chair for Asheville City Schools.
I'm Kidada Wynn, the Executive Director of Student Services for Asheville City Schools.
And David, if you can please unmute.
I'm David Thompson. I'm Director of Student Services for Buncombe County Schools.
Tony Baldwin, Superintendent of Buncombe County Schools.
I'm Freeman, Superintendent at Asheville City Schools.
And I'm Dockery, Executive Director of Crisis Management and Operations for Asheville City Schools.
Well, we're so glad to have everyone join us for today's conversation. And with that, we will start off by hearing from Dr. Freeman with Asheville City Schools. I want to share with everyone who's joining us a couple of quick facts and just give you a really quick high-level profile of our Asheville City school system. Asheville City Schools has 10 public schools and they serve 4,416 students. Interestingly, Asheville City Schools also has a minority or BIPOC student enrollment of 37%, and they are majority Black. And then also Asheville City Schools has 686 full-time staff and 22 part-time, with 222 of those holding advanced degrees. Rather impressive. So with that, I'll ask Dr. Freeman to kick our conversation up and give us an overview of what to expect for Asheville City Schools as we're opening in this time of COVID. Dr. Freeman?
As Asheville City Schools begins the new school year, it will look certainly different than any school year has looked historically. We are under the Plan C that the governor has allowed us to do, which is going to be remote/virtual learning, which means students will stay home and receive instruction online. When we return to school, things will continue to look very different. Our transportation will be under the guidelines of the North Carolina Department of Instruction, which the latest guidelines that were given on transportation was a student per seat. Previously, it had been a student every other seat, but one student per seat is what the guidelines say now. So when we return to an on-campus model, our transportation will be somewhat limited in more bus runs will be required because of the inability to fill the buses up. Once students return to school, there will still be the process of directional input in terms of signs on the floor directing students going to a class or moving from a class. Desks will be 6 feet apart according to the guidelines we've been given now. And teachers and administrators will monitor the social distancing to the best of their abilities, with students being required to wear masks, unless they have health reasons or other reasons that's documented that they can't wear those masks. We will probably return in a hybrid sort of configuration where part of the students will be here 1 week and part of the students the next week. And we certainly will encourage outside instruction as well as outside physical exercise or recreation as much as possible. We have even thought about doing some tents outside so that when instruction on campus happens, that we're able to do it outside. The biggest question for us and for everyone else is, when is that going to be? And that's something that's sort of up in the air right now in terms of, are we waiting for a vaccine? Are we waiting for the numbers to go down? And what does the science say about all that? It seems that when we wait for the numbers to go down and then we congregate, the numbers go back up. So we are sort of in that mode of, we don't know what's going to happen. So that's sort of where we are with student movement and how we're going to control it, with the unknown factor being, when do we create that hybrid kind of program to bring students back?
Thanks for all of that update, Dr. Freeman. Another question that I would like to ask, you did mention there may be some tents in terms of encouraging some outdoor. Can you share a little bit more what that looks like? And then can you also let us know, what's a lunch going to look like, particularly at your high schools?
As far as the tents, it's pretty easy. We're just going to rent tents from some business and have the tent set up, and we'll have to schedule those for different teachers to use. We can't find enough tents for everybody to have one anyway. And in terms of food service, it will be, we will not do a cafeteria style lunch. It will be in a student's room. That's to control just that socialization issue and keeping the distance that's required.
Thank you. And so next up, we have Dr. Tony Baldwin with Buncombe County Schools. And again, a few data facts for Buncombe County Schools. So Buncombe County Schools has 45 schools in 6 districts. Buncombe County Schools is the largest, it's the 13th largest school district in North Carolina and the largest in Western North Carolina, with approximately 24,404 students. So with that, and enough students to populate many of our Buncombe County towns. Dr. Baldwin, I will give the floor to you.
Thank you for having me. And very similar, Dr. Freeman described a number of components that I think are very true for Buncombe County Schools as well. Our first 2 weeks will be a little bit different. I would first say that our plan is a 6-week plan. And we start out by saying that 40% of those 23,000 students, the families chose to be remote only. So they will begin their school year. Actually, this week, they will have a virtual meet their teacher, and they will remain in that remote only mode for the first semester through December. And then who knows beyond that, as Dr. Freeman said, we're just living in such a cloudy environment for a crystal ball, and just change is the key word. But for the 60% that have chosen to remain on what particular plan that we operate under, of those 60%, K-12, they will be split into 2 groups. And on week 1 for kindergarten through 8th graders, our A group will begin on August 17th. And they will be in person for half a day for Monday and Wednesday. And then Group B will be in person for Tuesday and Thursday. Friday is a remote for all. And then for kindergarten through 8th grade, the next 5 weeks, they are sent out to cyberspace. And it will be a remote learning model that they will use. High school's a bit different. For high schools to accomplish that in-person launch, or what we call onboarding, which gives them at least a bit of a foundation before they move into the remote model. Plus, it allows us to do some upgrading with the technology and the devices. For that group, again, A, B, and for A, they will be Mondays, Wednesdays for 2 weeks, and Group B will be Tuesday, Thursdays, both weeks. And on each of those days, they will actually go to one of their class periods only, one of those courses. And that will address a concern for high school because of class changes. We want to eliminate the commingling. So again, it gives them a little bit of a foundation. And then for high school students, for those high school students, they will move into the next 4 weeks of remote only. And we will, again, as Dr. Freeman in Asheville City, we will look at the metrics, talk with our public health experts, get a lay of the land, and make a decision on what the future holds ahead of us. Talking about the social distancing, how will that be monitored? Again, it will be all hands on deck during these first 2 weeks. We would love to see our students help monitor themselves. We've been talking a lot about that this is a great opportunity for student leadership to come forward. So that will be interesting to watch. Again, the 3 W's are plastered everywhere, all over the walls and the floors in Buncombe County schools. Actually, I did bring with me, I didn't pull it off of a carpet, but we do have down the middle of most of our hallways yellow lines that split them like a highway. But we also have this sign, stop, maintain 6 foot distance. And I got a feeling you could probably find that at Asheville City Schools as well. So that's a little bit about what our start's going to look like.
Well, Dr. Baldwin, thank you. We appreciate props as we are all very much committed to connecting to various types of learning. And thank you for at least connecting our visual learners in this conversation. One thing that you did mention was around kind of the student leadership. And, I will, before we move on, I would also invite Dr. Freeman to even answer this. What are you hearing from the students, at least your student leadership, and how they are prepared to support any of the social distancing learning environment that's needed? Quite often we know peers follow what our other peers are. And so have you all worked with your student councils, governments, to identify some peer leaders that can help enforce the 3 W's?
I know we have, and we continue to do so, but what I hear mostly from our high school students is they really want to return back to school.
And Dr. Baldwin, are you hearing anything from some of your student leaders around how they can be peer supports and learning leaders in a COVID time?
I think that's taking place in a number of our high schools with some Zoom meetings. We're so used to Zoom as adults, but what I'm finding out is our high schools have actually done some of that with their student government leadership this summer. So like Dr. Freeman said, they're anxious to get back. And I think one of the things first and foremost on their mind is extracurriculars, the opportunity for band, the opportunity for fall sports. That is certainly on the top of their list.
Wonderful. I'm sure I can relate to what that must be like for students who are eager to connect with peers. And so with that, we would like to hear from Shaunda Sanford. Shaunda is on the Asheville City Schools Board and will share with us some of the recommendations and conversations that their board has considered in the policies going forward to guide Asheville City Schools during COVID. Shaunda?
Thank you. So I guess first I would be remiss if I didn't help people understand the process. So we don't make recommendations as the Board of Education. We actually take recommendations from the superintendent, and then we make the final decision after they've presented all the information. And in looking at the information that Dr. Freeman presented to us, initially we did start out with Plan B. But wanted to ensure the safety of our staff and our students. After further conversation, we did switch over to Plan C. So we've had to implement some employee COVID guidelines and manuals, and the staff has been preparing really hard for when the students come back to ensure the social distancing and how to keep every student safe, as well as working with community partners to determine how we can ensure that the remote learning is working and reaching all of our students. So as a board, we're definitely supporting our superintendent and his staff because they've been working really hard to ensure the safety of all of our students, and not just in the school when school starts back, but we've had a large number of our staff who've been serving lunches over the summer. So they've been still interacting and keeping tabs on our students and making sure that they have the resources needed in their communities and in their homes. So they've really been working hard. Our social workers and some of our instructional assistants and bus drivers, they've all been really working hard to make sure that our students and families are getting what they need during this pandemic.
Thank you. And then also another component that has come up is that how are Asheville City Schools, and I welcome Buncombe County to address this as well. What plans do you have in place to address access to computers and the internet? We do know that the digital divide is something that impacts, certain populations in our county beyond schools, and want to know what measures are in place and what accommodations have been made within both school systems. Shaunda, will you please start by answering for Asheville City Schools?
Sure. So all of our students were allowed, 312 were allowed to keep their devices that they use in school, their laptops. In March, they took those home and they were allowed to keep those over the summer. For those students that did not have access to internet, we did our best to get hotspots to all of those students. So the students continue to, get their needs met in terms of the digital learning, and those that did not have internet access, we provided that for them.
Thank you. And Dr. Baldwin, what does that look like for Buncombe County Schools?
Very similar. The last 3 months of 1920, I think we distributed, if I'm not mistaken, 472 hotspots across the county. We have some interesting areas that are not very conducive to picking up internet. So, but we did do a survey, and interestingly enough, we found that 93% of our students, we were able through the technology to access, but it still leaves 7% that we've had to provide in some type of packets, paper and pencil.
Thank you for that. So before we actually move on to our next panelist, I do want to throw out to the panelists some questions that have come off from our viewers on Facebook. And the first question, and this is related to, again, I think these questions are most likely for Dr. Freeman and Dr. Baldwin, is what is the plan if a teacher or student becomes ill? And also, are we going to require testing of our students and our teachers?
Well, for us, we're following our local health department's guidance on what we do with that, and that has been pretty consistent. As far as testing, the issue with testing is, number one, it's very difficult to get testing done unless it's an emergency. There just isn't an abundance of testing out there that entities can purchase. Number two, it's cost prohibitive. Some universities are testing all their students, and it's costing them tens of millions of dollars. And number three, and my wife is an MD, the problem with testing is it's a moment in time. If you're going to do testing and do it right, you really have to do it about every 5 days, because you can be asymptomatic and not have any issues at all. And then 5 or 6 days later, it can manifest. So the testing is not a cure-all, although some folks tend to think it is. So those are the issues that we face with the whole testing issue.
Yeah, I would agree totally with Gene in terms of the aspect that we hear a lot, well, why don't you just universally screen everyone before they come in? I think he's exactly right, and true from our end as well. If there is an issue, we do have clear written protocol on how we respond, but in every instance, the intent is going to be that we communicate directly with our local health and human services, and they will help guide in terms of the response.
Thank you. And so with that, have one other kind of, I guess, social distance protocol is there's been a question around any kind of barriers of plexiglass that may be placed in front of instructor or teacher desks. Is this something that has been considered? Does it make sense? Or, where are we in terms of this for our schools, barriers for instructors?
For Asheville City Schools, we're not bringing students back right away, although we have created those plexiglass safety kind of shields at in our administration offices where parents may come to ask questions. We've done that throughout our schools. Now, when students come back, we'll have to see what we're going to do with, or if we're going to use that, but it makes it awfully difficult. Teaching children is about moving around a classroom. It's about engaging and connecting. You can't stand behind a plexiglass shield and teach kids. And this is my opinion, it just doesn't work. So we'll have to see what we do with that. I do think science has proven that certain kind of masks are the best way to prevent this disease from transferring. And we have studied that, and we already have purchased those masks for our students and our teachers. But the plexiglass in an instructional classroom, I just don't know how it would work. Is it on wheels where the teacher moves it when they move? Which I'm being a little facetious with that.
Yeah, I would agree again with Dr. Freeman. I will tell you that we talk a lot about, as we move into remote learning, a concern about vulnerable populations of students. But we also realize, especially with 3,600 staff, that we have a percentage of those staff members that are vulnerable as well to COVID-19. So we have used plexiglass in various areas as an accommodation for some of those individuals. Our plexiglass primarily you would find in the main office areas and areas where there would be a higher traffic of possibly parents, visitors that would be coming in for exchanging of papers and information. So we have those, but they are not, as Dr. Freeman said, we don't have those barriers in our classroom between the kids and the students.
That is all helpful. And Dr. Baldwin, if you can please elaborate just very quickly, give us a couple of ideas on what vulnerable may mean for our instructors and teachers, and that vulnerable for the students. What type of health conditions, age, et cetera, might that relate to?
Well, I think it's a number of different factors: age, health, medical issues, immune compromise. We're working with those teachers. Our principals are having discussions on an individual basis, and we look at what type of accommodations can we make, because the vast majority of them, they want to be back in that classroom working with their kids. The vulnerable population side of students, though, is a concern as we look at some of our EC population. Again, this is generalizing, but that's a category we have concerns with, as well as our English second language learners, because that support that comes from the human element in terms of the instructional piece, it may not be there between the student and the computer. So when we talk about vulnerable populations, that's just two examples. And it could also include those students that are taking AP courses and college level courses, because that additional support that they, again, would not have necessarily in that virtual instruction between themselves and the computer is important. So those are just some examples.
Great. And you did mention one student type, and just to kind of democratize this conversation, and we're trying to remove jargon and technical terms. Can you please share EC in full?
Right, and I apologize, I should know better.
We all have a habit. It's okay, Dr. Baldwin.
Right. That's our exceptional children. It's a range of challenges. It could be learning disabilities. It could be for our progressive education program children, some very high intensity behavioral needs. And again, that includes academically gifted. So it has a wide range in that particular category of our student population.
Wonderful, thank you. And so with that, we are going to now move on to something that has been, kind of top of mind is the social and emotional learning, as we all consider the mental health impact of COVID, social distancing, and online learning for our Buncombe County and our Asheville City School students. So I'd like to open the floor to David Thompson from Buncombe County Schools to share with us what plans are in place, what considerations, and how we can all be part of the support culture and community for the social and emotional learning for our students during this pandemic. David?
Yes, thank you. We are working very, very diligently to put in place a wide range of social emotional supports and social emotional learning, not only for our students, but also for our staff and for our parents. We just completed today a very extensive training and looking at 3 signature practices for our teachers to enter into classroom instruction, to integrate into content area learning that talks about welcoming introductions, which gives student voice to what they're feeling, what they're bringing into classrooms, a way to do some type of engaging strategy during the instructional component, which may be social interaction focused on peer relationships, or it may be focused on things like self-awareness of where your thoughts and feelings are about the content that you're learning, as well as ways to maybe even just take a brain break if they're getting overloaded and do something that is physical and engaging to re-engage the brain in learning as a resilient skill. And then at the last, to use something that's called an optimistic closure. It's a way to pull together all of that learning around social emotional learning and connect it back to the content. As we know that students are bringing with them a lot of the stress that has happened during the pandemic, as well as many of our students bringing back some really significant thoughts about the racial injustice and experiences that they may have had during the summer. So we recognize that both of those are coming back into the classroom, and students need the ability to have that voice about what they're feeling as they come back to school.
Thank you. And so related to that, what tools do you have to help students who may be experiencing anxiety, distress, or even suicide ideation, as we do know that that's something that quite often impacts adolescents and teens?
Sure. Yeah, I kind of laid out for our counselors and social workers today in a conversation with them that we're really looking at our core instruction being really integrating social emotional learning, but where I see them coming in is really focus on, do our students have areas of need that are similar, and how can we do some group counseling or group instruction with those groups of students to support them and help them get through and learn a new skill to help them learn, as well as individual counseling from the school counselor, school social worker, school social worker providing adequate basic needs and connections that they need to make sure that students are engaged in learning. And then we have multiple mental health providers from our community agencies who work with different groups of schools, across our district. So those mental health providers, we've given information to our teachers and our counselors about how to access those services in a efficient way, making sure that we are responding and understanding. We've even given teachers a kind of a cheat sheet list of, if you see these behaviors, who do you talk to? Yeah, who do you refer to? What's your next step? If you see these behaviors in a virtual setting or in a classroom setting, what do you do? Here are some indicators that say this is a high risk. You need to pay attention to this behavior. Here's what you do, and here's who you connect with. So we're trying to be really aware of those things. Of course, we respond after hours a lot to anonymous reports of mental health stress and anxiety with our Say Something reporting app, and connect even there. But we also want to make sure that our counselor, our staff has access to the same kind of thing. So we're working with our providers to bring some group support into our staff from time to time. MAHEC is wanting to offer. They had a conversation with MAHEC yesterday. They recognize that teachers are now frontline workers. So they're going to try to tailor some of the same type of supports that they offer to frontline medical workers during the pandemic and tailor that to teacher needs and offer those to groups of teachers. So we're really trying to put together various things that kind of help meet that need.
Thank you, David. You've offered us so many different roads to go down, but I want to try to be brief in my follow-up questions to you. The first is, you did mention indicators. So, you know, I do have some questions around data for you. In the past, Buncombe County has been really innovative and forward-looking in terms of doing the social emotional learnings. And I believe recently you were doing that twice a year. What does that look like now? Have you been able to do assessments of your student body in a remote setting? And if not, you know, what pivots and how are you able to track trends and what is emerging around the emotional health and well-being of Buncombe County students?
We typically have given a social emotional survey twice a year. This past year, because virtual learning was so new to us, we did not do the student surveys online with our students this year. We did do staff surveys. So each staff member, K-12, did an assessment, a social emotional assessment of each of their students. So we do have that piece of information, and it's very useful for us deciding, as we plan social emotional learning this year, deciding what the emphasis should be. So we're going to ask them to kind of take a focus area of what do you think our students, what does the data say our students need? And can we focus on this theme of teaching for this 3 weeks and then go on to that next need? We will be doing, we've been working with the company that does our surveys. We will be trying to do those surveys in September virtually. It's doable at this point. We have a structure for doing that now. So we will be doing that in September so that we have that updated need with new groups of kids.
That's great, David. And then finally, I would just say, you know, even though you haven't been able to do it, at least you did mention that you all have a tracker or an app. What are you seeing anecdotally? And I will just give this to you as a final question before we go to our next panelist.
We do have a reporting app that's been provided by the state for grades 6 through 12, as well as a separate one that is a reporting a model for our elementary schools. What we did see initially during the remote learning in the spring is that very little calls, very few reports were made. We really weren't hearing much of anything. We knew that our students were in stress, they had to be, but we really weren't getting many reports. What I have seen very recently within the last week or so, because I get all of those reports from the county, is that we're seeing an increase over the last couple of weeks as we're looking at school starting, as kids are getting more comfortable, as they're reconnecting with each other with social media and other things, that we have had a few of those reports after hours especially, that come in that say students are feeling suicidal, they're feeling stressed, they're feeling depressed or anxious, or any of those things that are ways that other students report and say, I'm worried about my friend.
That's great. Glad to hear that students are there to be shoulders and advocates for one another in our schools. So next up, we'll like to welcome Kidada Wynn with Asheville City Schools. And much like David, she also will provide some overview and a context of what the social emotional learning planning for this year looks like for Asheville City Schools. Welcome, Kidada.
Thank you, Tom. Asheville City Schools Student Services Department has innovatively thought of ways to reconnect and collaborate with our students. We have what we call our virtual offices for all of our student services team members. So all social workers, all counselors, all student support specialists will have virtual offices that the students and their families can see each time they log in to their academic platform. Also, before our students start their academic work, there's a SEL, a social emotional learning check-in. Basically, it says, how are you doing? Do you have any questions from last night's academic or schoolwork? And do you have anything else you want to talk about? If the answer is yes, the teacher will alert the school counselor, social worker, and student support people, And we would direct the families and the students to go to their virtual office to set up individual appointments.
Thank you. And so Kidada, could you also, share for us how you all are, what instruments or program you have in place to learn more about the mental and emotional well-being of the Asheville City School students? Do you all assess or survey?
We do. So we uniquely have a position. It's our mental health liaison, who's a clinician that helps the teachers and all the student services providers to be able to do assessments and then triage services out accordingly. We also, like Mr. Thompson mentioned earlier, we reach out to a lot of our community agencies. I think the misunderstanding is that some of our students are more traumatized than they actually are saying or actually are feeling at the time. I think they're getting a little anxious because of the return of school, like Mr. Thompson said, and now we're readily available to support them with the transition back into our school settings. Even the new norm has created some anxiety in our children and in our students and our parents. So our mental health liaison and our mental health team are out there in the communities face to face, while maintaining social distancing, seeing if they need us to help triage services or offer something in regards to their basic needs. We haven't stopped working since March. Our student services department has worked tirelessly and creating ways to stay connected, social, emotionally, and with their basic needs.
And so with that, as you all have, been, around the clock, and we thank you for that, what type of trends and patterns are you all seeing for Asheville City Schools? We know that, the Asheville City Schools has a little bit more racial diversity. And so with the social action starting in late spring, early summer, has that impacted or has there been any interconnections? Can you please speak to that?
I can, absolutely. With the social unjust and unrest of what's going on in our community and in the world today, we have intentionally reached out to all of our students to talk and just have candid conversations about that. Basically, and really, what we're trying to do is engage our students and maintain some meaningful relationships. We know, especially with our Black and Brown communities and students, that relationship is key. So our number one priority is going out into their home settings, their communities, and engaging them in conversation about how they may feel about what's going on and offer our supports that way. So for us, for Asheville City Schools, one of our main focuses is having these meaningful relationships so that we will get real information from all students, and we will know because they will trust us if they need support through social, emotional, and mental health.
Wonderful, thank you. And with that, I would say, can you tell us a little bit more about any plans that may be in place for the 2020 to 2021 school year for also producing any any social emotional learning assessments for Asheville City Schools?
So we're reaching back and we're going to really hone in on the CASEL from DPI, the CASEL framework. And we have a social emotional team, a district team that's going to push into every school and help them engage the idea or even have a buy-in of the idea of social emotional learning being embedded in the academic core curriculum. We can't take 15 minutes out of a day and say it's for social emotional. It has to be a part and a way of the learning and teaching. So our social emotional team will take the CASEL framework and we will embed it in the core curriculum so that our students will get their social emotional and academic needs met.
Thank you, Kidada.
I'm sorry, is the social emotional framework that DPI has. It's talking about, like Mr. Thompson mentioned some interventions from CASEL, is engaging meaningful relationships, checking yourself to see how you might feel socially and emotionally, having good social connection with your peers. Although it's virtually, they still can have some very courageous conversations and build their social emotional aspects of themselves and of their classroom community.
And I guess I will, similarly as David shared, what are you all seeing in terms of peer reporting or your own independent staff monitoring from social media in terms of what students may be experiencing or what may be coming up and emerging?
So we had our crisis hotline available throughout the summer, and we had 3 calls, and all 3 calls were from peers calling in and wanting to have wellness checks for some peers that they were concerned about. So we plan to continue to have that crisis hotline available so that everyone has access and can confidently call in and get the support services they might need. So we want to maintain confidentiality while we serve our students. We also have a great relationship with our SROs who help us to continue to maintain that relationship with students without breaking confidentiality and going out and doing wellness checks. We have to make sure that we serve our students holistically, and a part of that is the social emotional aspect. So we're intentionally doing that.
Well, so glad to hear that. And I appreciate for that, grounding it in a holistic and whole student approach. So next we'd like to welcome April Dockery with Asheville City Schools. And April, I believe are you with Asheville Middle?
I was formerly the principal of Asheville Middle School, and now I'm the executive director of crisis management and operations.
Thank you. Well, welcome, April. If you can, please, from your executorship, share a little bit more on that crisis management programming within Asheville City Schools.
Yes, of course. We've worked very closely with our safety and school health teams to establish some safety protocols that we have shared with our principals and staff, our daily operations, how our student and staff health screenings will go. We've made sure that we have enough masks for our students. When they do a return, we have extra masks already, or face coverings for our staff and students already. We will do, just when students do return, we will do temperature checks and the daily screenings like our staff are receiving already. Except the only thing different is our students will actually receive those temperature checks as they get out of their cars or as they walk up to the main door or as they get off the school buses. And it's very similar to what Buncombe County is doing as well. We have established a system with our school nurses to follow up with any student and their families who have been excluded from school due to COVID exposure or a positive COVID test, to ensure that they have access to health care and continue to support them as they transition back into school by working with their families and the schools.
And so related to all of those safety measures that you are putting in place, can you speak to measures such as temperature checks, masks, and other PPE protocols you may have?
Yes, we have been very fortunate to secure enough PPE and face coverings for our students and our staff if they forget one or need one. The temperature checks are done by, we have health safety monitors at each school that are checking temperatures, and we're doing this health screenings as they come in the doors.
Thank you. And are there any other considerations specifically from your crisis perspective that you'd like to share with our viewers today?
Yes, it is very tedious work as the things are ever changing. It's an ever changing process. It evolves every day. We are very, very fortunate to have a close relationship with our public health providers. Mayhem does a wonderful job supporting us. We actually have a school nurse hotline that our parents can access for any COVID question. We've worked very tirelessly to make sure that our principals feel supported and see themselves as the COVID experts for their campus, and make sure that we are constantly layering in supports and giving them updates on a sometimes daily basis.
Wonderful. And do you by chance have the hotline number available to share, or should we come back before the closing so that we can at least disseminate that with everyone who is watching?
Yes, if you'll get, I will have it for you in 2 minutes.
Okay, so in the interim, we do have some questions that are coming in from Facebook that I do want to now transition and offer up to our panelists. So the first that we have is about the Plan C. So how about the kids that are picked for Plan C? When are they going to start school? Is this April? Is this going to be August 21st? Are they missing days of training, instruction? And so this is for Asheville City Schools.
Our kids start the 17th.
Okay.
That's just when they start. That's a requirement across the state.
And can you also speak to teachers teaching either in their classroom or from home? And what this looks like for both of our school systems? What is the requirement relatively?
For Asheville City Schools, our teachers are required to teach from their classrooms unless they have documented health concerns from their physician. And the reason for that is, number one, it allows us to be able to monitor and to collaborate and to really work together to make sure that the kids are getting the instruction that they need. A couple of things also, we're going to have several hundred students based on history that are very difficult to find. So it's not only teachers that are going to be on campus, but custodians, non-core academic folk like librarians, technology. We're going to use, and teacher assistants and instructional assistants, cafeteria workers. We're going to follow safety procedures, but we're going to have to revamp our work a little bit because we're going to need those folks to help us locate students that may not immediately get online and start working. That's something that you have to think about. I wish every student would jump online as soon as possible, but we're going to have a couple of hundred or more, I'm sure, that we're going to have to really search out. So when we talk about teachers being our frontline workers, they absolutely are. But this district is full of other people that are frontline workers. Again, our cafeteria workers. We tend to forget all these other people, and everybody contributes in a meaningful way to make every student successful. So we have a lot of folks that are frontline workers that we can't forget that are also putting themselves on the line. But for Asheville City Schools, it's just better if we have people on campus that are following safety guidelines so that we can monitor, validate, and help with encouragement and professional development while instructing students.
Thank you, Dr. Freeman, for outlining that very complex and dynamic community that is actually on your campus. And I do want to give a chance for Dr. Baldwin to answer this question from the Buncombe County Schools perspective. But first, Dr. Freeman, if you can please share with us very quickly, what do you think anecdotally may be informing those hard to find students? Is that a socioeconomic, just briefly, what factors may be at play for them?
Well, I think we can say a lack of advocacy at home, possibly. We also have kids that are disenfranchised from the classroom who feel that their needs are not being met, that feel that they are not part of the community. I think it's well noted that Asheville City Schools has a dichotomy in terms of perspectives on community. We have kids from very low income situations, and we have very wealthy. And I think we've got to continue to make sure that all kids feel that they're part of this community. And those kids who do not feel part of it, we've got to make sure that we're educating those students also. Not every kid in our district, if we're really honest, really wants to come back to a classroom that they don't feel is part of their community. And we've got to change that. I'm sure that's not something people want to hear, but it is the reality that we face. So not only do we have to work with our kids during this pandemic on their social and emotional needs, we've also got to work with staff so that they can meet students where they are, because we're going to have a dichotomy of needs when these students come back, and we are coming back to school at some point.
Well said, and thank you for that candid and very pointed response. So, Dr. Baldwin, if you can please also offer for us, what does a school campus look like in terms of presence from the staff to the supports on Buncombe County Schools campuses?
Well, similar to Asheville City, our teachers are going to be asked to be in the building. A lot of that is the collaboration, the opportunity to better synchronize the remote learning, the virtual instruction piece, as we move into those 5 and 4 weeks of all Buncombe County students being on that platform. And I really appreciate Dr. Freeman's reality check. I think that is so very true of Buncombe County schools as well. A conservative estimate for our fairly large, we're the 13th largest system in the state, 51%, and that's a conservative percentage of our students are on free and reduced lunch, and that's an indicator that concerns us. Again, I go back to the term vulnerable populations. And for some students, as we found out the last 3 months when we essentially were in crisis management from 1920 and our schools were closed, we were in phase 1 from the state. We simply did the very best we could. And I think Asheville City would also be there. It was amazing how well our teachers did under those circumstances. But our expectations are much better and much higher for this school year and what that's going to look like. And again, that's going to take a lot of collaboration and planning. And for those vulnerable populations, we want to find out who they are and look at possible opportunities to bring them in on a very limited basis to get that additional support. Because if we don't, as Dr. Freeman says, we're going to stand a chance of losing these students. For many, that last 3 months of the school year is already an area that we've got to address to bring them back up.
Well, thank you for that. And related, so we do have 2 questions that have come in the chat. So, and I want to combine them, and I'll open this up to anyone on the panel to respond. What happens to parents who decide that they want to keep their children home, however, are now registered within your school systems? And then on the other side, what consequences are there for students who do not return? So we've obviously talked about the profile of students who may not, who may be hard to locate, but what happens, what are the consequences for parents who keep their children home? And then also for, or parents who decide not to have their children engaging in whatever educational and instructional format, and also for resistant and non-engaged students. What happens?
For Asheville City Schools, we are creating a virtual academy of sorts. I don't want to speak for Tony, but I think they already have a virtual setting. We do not. And that's something that we're working on. There's no consequence if a parent chooses to do that. And I firmly think that if we do come back to a on-campus arrangement in the future, there will be parents who choose to go the virtual route with their kids, and we're just going to have to make it work somehow.
And I'll try to address a little bit about where we are with reaching out to students. And we understand that there are many barriers to students accessing virtual learning. We are using our social workers. We have 26 social workers, and I've contracted for 3 additional extra ones for fall, as well as an intervention counselor. So we can reach out to those families to say, what are those barriers and how can we overcome those? It's not about consequences. It's not about punishment, but it's about accessing learning. And if virtual doesn't work for you, then how can we offer them a way to access their learning in a different way? How can we use phone calls? How can we use connections? It's really that many of the barriers are really around what Dr. Freeman mentioned earlier, is that sense of belonging. And how can we reach out and offer that support to our families? Our intervention counselor can provide some just short-term support for families or individual students to help help them understand where they are and what those barriers are, and then help them make that connection back to learning. So we want them engaged. We want them connected to either virtual or to some hybrid format. We do have Virtual Academy, and for some, we can create that real creative learning plan that connects them to that Virtual Academy that can go on for as long as they need and want to and engage in Virtual Academy and complete their graduation requirements through that. So it is, and we've expanded that this year thanks to Dr. Baldwin and the board. We've expanded that Virtual Academy this year to offer more and employed a counselor for them. They now have their leadership and their a counselor who is available to the students within Virtual Academy. So we will try, as our technology folks like to say, really to personalize that learning, to see that we're trying to meet the needs of the students, because we know that education is going to be important to them, whether they choose to go to the workforce or whether they choose to go on to post-secondary.
I would
Thank you.
add beyond search and recover, which is sort of our core concept with our graduation initiative, that I think this is a great opportunity for outreach into our community. Our school systems cannot do this alone. And we have got parents out there, possibly single parents that want the very best for their child. But they may struggle under this platform. And so, we try to make an outreach to our nonprofits, our faith-based community, to develop some programs to support this remote learning piece. Again, to add that tutoring and mentoring that adds that sense of belonging. Because again, our best laid plans and our best outreach, we have got to have help from our community. Because that's what it's all about. If we have students fall so far behind, the impact is going to be tremendously negative to our community as a whole.
Thank you, Dr. Baldwin. And I would just kind of add, I have to give a lot of credit to our nonprofits and some work that Dr. Baldwin has already begun doing with our faith-based community to offer support across there. But our United Way is a vital partner with us, and the community partners that we have through them around our community schools models, which is really just about creating hubs of services that exist within our schools, because we know that that's where many families depend on getting those services. So are those supports in place? Our community leaders that are part of United Way to reach out to businesses, reach out to faith partners and create those supports, as well as to give parents that student voice and engagement to be part of the decision making. So I'll give them a lot of props to help us, as well as the Asheville City Schools. I know we're engaged in that same partnership with Asheville City.
It really is a collective effort. And so as we are close to the final portion of our conversation, do want to touch on two different topics. And that is first, in terms of culture, we did mention Western North Carolina and Buncombe County in particular has a rich arts community. And so there has been some comments in the chat. And so there's an ask where there have been some strong statistics and data in that arts are very important intervention to advance social and emotional well-being and address any mental and emotional distress. So the ask here is, will you add additional arts and creative curriculum within this COVID instructional framing? And with this, I'd ask for a quick response from any of our panelists.
Yes.
Okay.
We're going to have to make sure that the non-core content folks are integrating and working with the core content so that our kids do have that chance with those.
And I'll add one ask. Does this include virtual instrument, band, musical instruction?
Yes.
Thank you. And what about for Buncombe County Schools?
I'll have to say that one of the biggest enthusiasts as we were planning social emotional learning with our instructional staff was our arts coordinator. She was on board before I even mentioned it to her. So she is leading her staff to integrate those social emotional supports into the arts as we speak. So.
Fantastic. And Dr. Baldwin, did you have a comment to add on that?
No.
Oh, okay. So glad to hear that we do have a culture of arts and creativity in our schools. And so finally, we would like to close and recognize that Buncombe County and Asheville City School is home to many champions. And so regardless of what jersey you're wearing, whether it's the Jets, whether it's the Rockets, or whether it's the Cougars, we are all winners. And so can you please share with us, what does the athletic school year look like?
I'm a little worried about it. Could everybody hear me? I'm a little concerned.
Yes.
With it. I mean, that's all I know what to say right now. I'm concerned with what that looks like. I mean, if you look at the facts, when we bring kids together, even with safety measures, there's usually an outbreak of some sort. I mean, you can see that across the country. And so I don't know, maybe Tony has an answer, but I don't have an answer yet.
I would agree. It is, again, it's such a cloudy crystal ball, but it's important. I think it's essential for so many of our student athletes, male and female, to continue that activity. I guess I'm an eternal optimist. I hope that even if it's on an abbreviated type schedule, I just don't see it happening in the near future, but at some point in time in the school year, who knows? We may see a abbreviated schedule for all of our sports, and I think that would make a lot of individuals happy from both sides of our school systems.
A lot for us to explore, and again, I imagine that we may soon mirror what many of our colleges and universities are doing, regardless of the conference that they're in. And so with that, I want to say thank you, and this concludes today's presentation. Before we leave, I do want to share some key recommendations, and these are coming from Rashida McDaniels, who's a co-producer for today's town hall and webinar. And this is some important key tips to share with parents and also community on what to expect specifically for some of those exceptional students in our community. And what she's sharing is that if your child has an individual IEP program or individualized education program or 504 plan or receives other learning that is possibly tutoring, ask your school for how these services will continue. Also, if your child receives mental or behavioral services, this could be social skills training, counseling, to also connect with your school for ensuring that you have all of the necessary resources to continue continuity for your child or for any of the students that you may have in your community that you support. And then also to make sure information is current at your school. That includes emergency contacts, individuals authorized to, I guess, in a physical context, pick up your children or at least be there as a representative. And if that list includes anyone who is at increased risk for severe illness from COVID, to consider identifying an alternate person. So thank you, Rashida, and also thank you to all of our panelists, and thank you to all of those who did take part in this conversation. We will be archiving, and this, the contents of today's discussion will be available on Buncombe County as well as on our Facebook page. So thank you to all, and as a reminder to be well and stay safe, and again, to follow the 3 W's, wear, wash, and wait. Thank you again, and we look forward to you joining our next Let's Talk COVID. And until then, stay safe.